Greetings. This is Rob Cipriano. I'm an advisory board member to Cortico and also a licensed psychologist in Florida and North Carolina. I'm board certified in police and public safety psychology by the American Board of Professional Psychology. I'm also a member of the International Associations of Chief of Police, Psychological Services Section, and I'm a current member of Division 18, Psychologist in Public Service of the American Psychological Association. Today we're going to be talking about anxiety in relation to the COVID-19 crisis. When we think about anxiety, we look at three particular areas. We look at anxiety based on physiology, which includes body reactions such as rapid heartbeat, muscle tension, queasiness, dry mouth, or sweating. We also look at it behaviorally. It can sabotage our ability to think, act, express, or cope with certain everyday situations. Psychologically, it's a subjective state of apprehension and uneasiness, also known as the phrase, thoughts become words, words become actions. What we tell ourselves, internal dialogue. There's three levels of recovery. We want to focus today on reducing physiological reactivity, eliminating avoidance behavior, which is basically a double negative, so not avoiding, and changing that internal dialogue or self-talk, which we can perpetuate a state of apprehension and worry if we continue going down that road. Anxiety can appear in different forms and at different levels of intensity. There are a few disorders that we're going to talk about, but in particular, we're going to talk a little bit about the differences and distinctions between acute stress disorder and post-traumatic stress. One of the key hallmarks between the two is time frame. And the other key aspect, which is different than most disorders, there is an outside event that can trigger a reaction. So in this COVID-19 situation, that is an outside event. It can cause an array of different reactions. So when we look at acute stress and post-traumatic, again, the only difference is time frame. There can be other conditions and disorders that result and that people experience, such as panic disorder, phobias, obsessive compulsive disorder, and generalized anxiety disorder. With PTSD being that outside triggering event, it can create an array of other traits and characteristics and not meet the full criteria for a full-fledged disorder. What actually embodies it is three areas: intensity, duration, and frequency. And does it affect our ability to socialize, to do our job and or school or any other event that we're involved in? And does it also affect our ability for being from a legal perspective? So those are three areas that we need to look at when we're talking about a difference between a disorder and a trait. Some of the signs of stress from COVID-19 can also look like chest tightness and feeling that you can't breathe, muscle tension, aches and pains, headaches, difficulty sleeping, restlessness and inability to relax, heart palpitations, digestive issues. These are other areas of stress that don't necessarily result from physical aspects of COVID-19. So we want to look at them as well from a behavioral health perspective. Scanning for threats. Our thoughts may be triggered by the environment for what we fear, consciously or subconsciously. Scanning for threats is often associated with our minds assigning meaning to harmless events. That fight or flight response to dangerous situations or triggers pretty much involve changes that our bodies go through that can increase heart rate, a narrowing of vision, muscle tension, sweating, and more sensitive hearing. These changes are adaptive as they're preparing you for that fight or freeze response, but also the flee response. So it's actually fight, flight, and or freeze. It's actually three responses that can occur in these situations. Problem is when these start happening in very typical / normal types of encounters. So they now start going from adaptive, which is healthy, to maladaptive, which is unhealthy. Another area that we want to be careful of during this COVID-19 is what we call catastrophizing. It's when we react to disappointment or failure as though it means the end of the world. Example, I feel a sore throat coming on. I may end up on a ventilator and die. So the person goes from 0 to 60 very, very quickly. What also happens, the trigger of the catastrophizing is an inner dialogue, such as shoulds, woulds, coulds, always, must, and never. There's absolutes in there. There's also these very, very extreme thoughts that occur, and they can formulate an expectation versus process-oriented thinking. So what do I mean by expectation versus process-oriented thinking? Expectations are generally outcomes. So you have an expectation, for example, well, I should be healthy. But all of a sudden, I start getting sick. Maybe I end up with a sore throat. I start sneezing. And now that person goes to the extreme. I'm going to end up in a ventilator and die. A goal, rather, in process-oriented thinking, looks at changing that inner dialogue. And one of the things to change the inner dialogue is, am I looking at the whole picture? Am I looking at things from more of a reality-based scenario? What are the chances that I've caught it? What are the chances that I'm going to end up on a ventilator, doing all the things that I should be doing during this quarantine and maintaining social distance? So it just helps you from a process perspective where you start questioning that catastrophizing or those thoughts that start leading down a road that really are very difficult to recover from. So it's that first, what I call stopgap in being able to control the string of beads of your thoughts. Thought 1 on the bead chain is going to be a lot less powerful than thought 40 of the bead chain if we continue thinking in a negative way. Reasoning from emotions is another common one that we see during times of crisis and anxiety-based situations. We believe that because we feel a certain way, that indicates the truth about a situation, and we may even act accordingly if it hurts us in the long run. Reality-based management tools during the COVID-19 pandemic are the vast majority of people only experience relatively mild symptoms. The COVID-19 virus is fatal in about 2 to 3% of cases. Health advice for the public is as follows. Wash your hands with warm water and soap for at least 20 seconds. After coughing or sneezing, before, during, and after you prepare food. Before eating, after toilet usage, when you get in from outdoors, when hands are visibly dirty, and when caring for the elderly or sick. After handling animals or animal waste, use alcohol-based sanitizers as a substitute for washing your hands, but do so sparingly. Maintain a distance of at least 6 feet between yourself and anyone who is coughing or sneezing. Cover your cough and sneezes and throw your tissue into a closed bin immediately after usage. Avoid touching your eyes, nose, and mouth, and frequently disinfecting surfaces like your desk phone, tablet, smartphone, and any type of countertop. The benefits of relaxation during this time are priceless. And what they do on a regular basis, if you practice them, is they can decrease your heart rate, your respiration rate, your blood pressure, your skeletal muscle tension, and your metabolic rate and oxygen consumption. It can also decrease analytical thinking and help you with skin responses. When I talk to you a little bit about that self-dialogue, what I'm focusing on is looking at the outside event, the triggering event. And as you look at that, maintaining an understanding and being aware of what your interpretation of that event is based upon your self-talk. And then also now assessing how you feel and then you react. Hence the phrase, thoughts become words, words become actions. For example, what if I panic? What if something goes wrong? What if I can't handle it? This is an example of an anxiety-based type of thought that will trigger an anxiety-based type of reaction/feeling. So that internal dialogue generates from the what if. What ifs in this type of situation also lead to catastrophizing and going down that road. Acknowledging a positive self-supportive statement is the first step in overcoming the negative thought emotional reaction. So what we want to do is we want to replace that what if with some type of self-supportive statement that can reinforce our ability to cope. Some positive self-supportive statements that will counteract negative self-talk include: number one, what is the evidence for this? Is this always true? Has this been true within the past? What are the odds of this really happening or being true? What is the very worst that could happen? And again, am I looking at the whole picture? Those 6 questions, in a nutshell, will help us really formulate that stopgap in that anxiety-based reaction or string of beads as it relates to that negative self-talk. Eliminating negative self-talk statements also involve other areas aside from catastrophizing, what we call an inflated negative outcome, underestimation of coping ability, distorted thinking, overgeneralizing, my example earlier of should statements, and emotional reasoning. The evidence-based protective factors that contribute to resilience are these: optimism, effective problem solving, faith, sense of meaning, self-efficacy or effectiveness, flexibility, impulse control, empathy, family and close relationships, and spirituality. I thank you for your time in listening to my training today, presented to you by Cortico, and I wish you a healthy, safe, successful, and happy year.